What is urethritis and how does it affect the urethra? Imagine a tiny tube that acts as a highway for your urine, running from your bladder out of your body. That's the urethra, a vital part of your urinary system. When it becomes inflamed, it's called urethritis, and it can cause quite a bit of discomfort. Urethritis usually happens because of an infection, most often bacterial. Common culprits include bacteria that cause sexually transmitted infections like gonorrhea and chlamydia. Viruses such as herpes simplex can also be involved, along with parasites like trichomonas. Sometimes, non-infectious causes like irritation from chemicals or injury can lead to urethritis too. When the urethra gets inflamed, it swells and becomes irritated. This can make urination painful or difficult, and you might feel a frequent or urgent need to go. Some people notice a discharge from the urethra or itching around the area. Men might see blood in their urine or semen, and they could experience swelling or tenderness of the penis. Pain during ejaculation or sex is also common. Women may experience pelvic pain, pain during intercourse, or unusual vaginal discharge. Interestingly, some cases, especially in women, might not show symptoms at all but still carry the risk of spreading infection to reproductive organs. The inflammation affects the urethra by causing swelling and irritation, which can interfere with the normal flow of urine. This can lead to discomfort and sometimes complications if not treated. For example, untreated urethritis can cause scarring and narrowing of the urethra, known as urethral strictures. In men, infections can spread to the testicles, causing epididymitis, or lead to joint problems called reactive arthritis. Women with untreated urethritis are at higher risk for pelvic inflammatory disease, which can cause long-term pelvic pain and increase the chance of miscarriage. These issues can also impact bladder health by causing urinary blockages or secondary infections that involve the bladder or other parts of the urinary tract. Diagnosing urethritis involves a physical exam and laboratory tests like urinalysis, urine cultures, and swabs from the urethra. Tests for sexually transmitted infections are also common. Treatment usually involves antibiotics to target the bacteria causing the infection. Early diagnosis and proper treatment are essential to prevent complications and protect both urinary and reproductive health. From a bladder health perspective, chronic inflammation from urethritis can contribute to ongoing irritation in the urinary tract. While urethritis itself isn't directly linked to bladder cancer, persistent infections and inflammation are recognized factors that may increase the risk of bladder cancer over time. Keeping the urethra and bladder healthy by treating infections promptly is important for overall urinary tract health. Remember, if you experience symptoms of urethritis, it's best to see a healthcare professional for accurate diagnosis and appropriate treatment. Taking care of your urinary health helps prevent more serious issues down the line and keeps your system functioning smoothly.